Hey, everyone! Welcome back to the channel. Today, I'm thrilled to show you a step-by-step guide of getting a ceramic inlay, all in just one visit.
Hello everyone, thank you for joining us today. My name is Jenny and I'm a part of education team at Medit. Nice to meet everyone, and today we have Dr. Kim here.
Hi, Jenny, and welcome everyone. It is a pleasure to be here again. Thank you for inviting me over to this webinar as always.
Yeah, of course. We always enjoy your lectures a lot. I especially like the topic of setting a vertical dimension in edentulous case. The process seems so simple and clear.
Yeah, thank you for enjoying the lecture. Dentistry has definitely simplified the workflow. With the help of Medit apps, it is so easy to create all the kind of processes that come to my imagination. I myself am also enjoying a lot exploring digital dentistry.
Yeah, I think that's why your lectures including so many clinical tips. We always thank you.
Ah, no worries. Today, I prepared something special webinar, which is like a vlog time.
Reload time. Wow, what's that about?
I wanted to share my daily practice with you in real time, so it's going to be more like a vlog than a lecture. I'm going to show you the entire process from the patient visit to the clinic all the way to the inner restoration, all completed in a single day visit, and it will all be done digitally.
Wow, everyone might have wanted to see your real daily practice. It would be a great opportunity to see how you do a single visit treatment in a digital way.
Yes, right. There are some cases where the inmate had to restore on the same day. For example, when achieving optimal bond strength is critical or to avoid the need for temporary filling. So I definitely believe that it is beneficial to the patient, and moreover, the workflow is so simple. I believe we all can apply this in every daily practice.
Sounds so great. Then shall we begin, doctor?
Hey, everyone! Welcome back to the channel. Today, I'm thrilled to show you a step-by-step guide of getting a ceramic inlay, all in just one visit. We're using the cutting-edge Medit scanner, i900, so let's get started. First up, our patient undergoes a panoramic X-ray. This helps us get a clear view of the mouth and pinpoint exactly where the treatment is needed. Today, we're focusing on replacing an old amalgam, filling at tooth number 36 with a ceramic inlay. With the area identified, it's time for anesthesia. A little topical numbing followed by a block injection ensures that our patient is comfortable throughout the procedure. Now, let's boot up the Medit app and create a case for our patient. We start with a diagnostic scan, which is super smooth thanks to the i900's wide field of view. We scan the upper jaw, then the lower, and capture the bite relationship. All this in just about a minute. All right, it's time to get down to business. We place a rubber dam to isolate the tooth, then carefully remove the old amalgam filling. Using a spoon excavator, we scrape away any remaining decay. Next, we use a handpiece to clean the area thoroughly. We then apply a resin base, spreading etching with a micro brush to ensure good penetration. We rinse, apply the bonding agent, spread it thinly with air, and cure it with light before layering on the resin. Now comes the cool part, designing the inlay. We use ClinicAD, a free software by Medit Link. We select the form of the tooth, set it as an inlay, and ensure all scans are properly aligned before starting the design. Using the diagnostic scans and the opposing teeth as a reference, we set the margins and insertion direction. We place the tooth library in the correct position and tweak the outer form. Then, we attach the handle for milling connections. Over at the mill, we choose a block that matches the size and material needed for the inlay. After positioning the designed inlay in the software, we connect it to the block with connectors and start the mill. The process is automated, and the inlay is precisely carved out. Once milled, we remove the inlay, cut off the connectors, and begin polishing. After polishing, we wash and apply hydrofluoric acid to the inner surface. A quick steam, clean and drying, and our inlay is almost ready. Back at the clinic, we reinstall the rubber dam and clean the cavity. We etch, rinse, dry, and apply a bonding agent. After curing, we check the fit of the inlay and, if all is good, cement it into place, removing any excess adhesive. Final step, polishing with a white stone burr, checking the bite with bite paper, and if everything's good, a final polish to finish off. And there you have it, a brand new inlay, all set in just one visit. Thanks for watching our complete guide to a same-day ceramic inlay. If you found this insightful, give us a thumbs up, subscribe for more dental adventures, and ring that bell for notifications. Keep smiling and see you next time.
Thank you for sharing all your tips with us, Dr. Kim. It was really impressive that you had explained each step so clearly.
My pleasure. I tried to show my actual daily practice. I hope everyone had enjoyed the webinar.
Yeah, for sure. So let's move on to Q&A sessions. So today we have 4 questions in total. So I'll start with the first one. Question number 1. Do you prefer single visit dentistry treatment? How many hours does it take to go through all the cycle, for example, in a single case?
Yes, I do prefer single visit dentistry treatment because it is convenient for both the dentist and the patient, reducing the need for multiple appointments. For example, in the case of a ceramic inlay, the process is quite efficient, approximately 30 minutes for anesthesia, cavity preparation, and the intraoral scan. The design and fabrication of the inlay take around 40 minutes, followed by 20 minutes for surface treatment and bonding. Altogether, this sums up to about an hour and a half. For zirconia crown, the process is similar to that of the inlay. However, due to the required sintering time, it takes about an additional hour. Therefore, the entire process for zirconia crown typically takes around 2.5 hours.
I think it's taking a little time than I had expected. Okay, question number 2. How do patients spend their time while waiting for the processes fabrications? Because definitely it takes time until the crown to be fabricated.
During the waiting period for the prosthesis fabrication, patients have several options to occupy their time. Some patients choose to get a scaling treatment, which can be done in the meantime. Others prefer to go home and return once the prosthesis is ready. Additionally, many patients take the opportunity to have lunch or snack at a nearby restaurant or cafe.
Okay. Question number 3. Do you prefer printing or milling in single visit dentistry treatment? Do you only do provisional restoration or do you do final restorations as well in a single visit dentistry treatment?
In single visit dentistry treatment, I prefer milling over printing, especially for final restorations. This preference is due to my experience with the durability of printed prostheses, which tend to lack the long-term strength required for final restorations. Therefore, for final restorations, I primarily use milling to ensure the highest quality and durability. However, provisional restoration can be printed if needed, but the focus remains on milling for final restorations.
Okay, last question. Question number 4. Is there any clinical tip that you would like to share for those who are willing to do a single visit dentistry treatment?
When considering single visit dentistry treatment and performing the design and fabrication in-house, there are several important factors to keep in mind. One of the most crucial aspects is to make the design process as simple and quick as possible. Additionally, it is crucial to choose milling equipment that can accurately produce the prostheses according to the design specifications. From this perspective, it is encountering to note that design software is becoming increasingly automated. This automation trend signifies that in-house fabrication is becoming more accessible and feasible for a broad range of dental professionals. As the software continues to advance, the time and skill required to perform these tests will decrease, making single-visit dentistry treatment more efficient and widespread.
Okay, that's all about it for today. So you'll be able to watch this webinar on our YouTube channel and Medit Academy once it's completed. Thank you for being here, Dr. Kim.
Thanks to everyone for joining us today. Hope to see you at our next webinar. Bye.
Bye.